have reignited the conversation about addiction and its impact on mental health. Dr. Daryl Shorter is a medical director of addiction services at the Menninger Clinic. So we know, doctor, you are not treating this suspect, but when we talk about drug addiction, that sometimes can worsen mental health. Is that correct?
Absolutely. We see that the intersection of addiction and mental health can actually worsen or exacerbate either one of those very conditions. If someone is struggling with depression or anxiety, they may be more likely to use substances as a way of managing those feelings. And at the same time, we recognize that substances can cause or worsen depression, anxiety, and cause other types of mental health conditions as well.
So it's really a tough conversation that parents may have to have sometimes with their kids when they are struggling with addiction. How do they do that?
Oh, goodness, with honesty and forthrightness. One of the first things I really encourage families and parents to do in particular is to look at themselves and their own behavior, because what they are modeling for their kids is very likely to be repeated. So if a parent is struggling with their own mental health or substance use, that might be the first thing that they need to do before they even begin to engage in a conversation with their kids. They also want to approach them with honesty and let them know that regardless of what's going on, I got you, I'm going to support you, we love you, and we're going to handle this and address this as a family.
So we're hearing that the son was actually struggling with addiction since his teenage years, so that can, as we know, can snowball into a bigger issue once you're an adult.
Absolutely. We've talked a lot over the course of the last several decades about gateway drugs, and gateway drugs sort of change over time. One of the things that I encourage parents and families to really pay attention to are things like vaping, use of e-cigarettes. Also, nicotine pouches are gaining traction among adolescents as well. It's no longer that we're seeing kids engage in alcohol use the way that we used to. It seems to be vaping, both nicotine products and cannabinoids, that seem to be the sort of gateways to other types of substances as well. So really talking to parents, having conversations with their kids about the dangers of not only engaging in alcohol use or substance use, but really nicotine use and cannabis use can be pretty critical.
So I know TMZ is reporting that the wife was telling friends they literally tried everything. What can you do when you're at the end of, like, I've tried this, I've tried conversations, we've done this, we've even maybe even sent the person to rehab and things like that. What can you really do?
Well, one of the things that I try to tell people is that not every treatment episode will result in people immediately establishing abstinence or getting sober. It's one of those things that sometimes you have to keep at. And it's a marathon and not a sprint, and that people can oftentimes experience a recurrence of use or what we refer to as a relapse, but that doesn't necessarily mean that that's the end of the story for that individual. And making sure that that individual has plenty of support and oversight. Parental involvement is one of the most important protective factors that we know of when it comes to preventing or reducing substance use among adolescents.
Yeah. Tough conversations to have, but you definitely have shared some insight that people need to know for sure. Dr. Daryl Shorter, thank you so much.
Thank you.
All right.
Thanks for having me.
Thanks.